Thank you, Amy, so much for the invitation to be here and for having all of us from the Alliance for Aging Research. We're really excited to get the chance to talk about Heart Valve Disease Awareness Day, but also to have you guys as partners, because we couldn't do this without our partners, which I'll talk a little bit about in a few minutes. But just wanted to tell you how grateful we are to be here. And how's my mic? Am I loud? Yeah, I'm loud. Put it down here by my stomach. So I know there's a lot of people in the room who know what heart valve disease is, but for those of you who don't, just a very quick look at it. It's a disease that involves one of the four leaflets in the heart, and affects as many as 11.6 million people in the US. And for us at the Alliance for Aging Research, we're acutely aware of the fact that 1 in 10 people age 75 and over are impacted by heart valve disease. And unfortunately, even though it can usually be successfully treated, around 25,000 Americans die every year from the disease. So just a quick look at what it means. So valve disease is a disease of any of the heart's four valves. So any of the leaflets between the four chambers can become diseased and lead to valve disease. And basically what happens is when there's a diseased valve, it no longer can control the blood moving from one chamber to the next, and it can either leak or not get through adequately. So there's really two main types. You can have regurgitation, where essentially the valves are no longer properly closing and it leaks backwards, or you can have stenosis, where the valve is stiffened and therefore it's not able to get through adequately. There's a number of risk factors and causes. Some people are born with a bicuspid valve, so they have 2 leaflets instead of the normal 3. The most common cause is aging and calcification of the valve, which causes that stenosis that I just mentioned. Other cardiovascular disease and conditions can lead to problems with the heart that can cause damage to the valve. It's really rare in the US, but strep throat, when it's untreated, can lead to rheumatic fever, which can cause a diseased valve, and so there's a lot of cases of that in other parts of the world. And then, as I mentioned, age is a major risk factor for valve disease. I focus in on the symptoms because I think that's one of the most important messages of our campaign, is to know the symptoms. And you can see here a number of those symptoms, but I think one of the major points that we always try to make is that a lot of people don't have symptoms, and too often people who do dismiss those symptoms, and even have their healthcare professionals dismiss those symptoms as a normal part of aging. So they start to slow down, they start to feel like things are harder to do, it's harder to go up the stairs, go out to the mailbox, and they think, oh, I'm just getting old. And they accept those symptoms when in fact it is valve disease. And unfortunately that's perpetuated too often when they go in and report their symptoms. So sometimes it's as easy as a simple listening to the heart with a stethoscope to detect heart valve disease. They often can hear a murmur, and so it can just be a regular checkup that diagnoses heart valve disease. There's other tests that are often used to confirm the diagnosis, to get more information, but we really are focusing in on this idea that you need to listen to your heart. So we are teaching people through the Awareness Day campaign that if they have the risk factors, if they have symptoms, they really need to go and make sure they're having an annual checkup. Make sure that their heart's always being listened to, which we actually know from survey work that we've done that not all healthcare professionals are listening to the patient's heart at every visit. And so we just are encouraging people to always get it checked. And I know that there's others on the agenda who will talk about treatment, but sometimes it's monitoring, sometimes it's medication, but most of the time it's repair and replacement. But luckily there's a lot of options out there for people, and they're getting less and less invasive, and usually it can be successfully treated now in patients of all ages. So why Heart Valve Disease Awareness Day? Obviously it's a serious condition. About 11 million people have it, but we also found that people don't know anything about it. So we commissioned a survey in 2016. We did a random poll of about 2,000 people, and we found that, bottom line, there's a lot of data here, but 3 out of 4 people know little to nothing about the disease. So people know a lot about the symptoms of stroke, they know what to think about with heart attack, but people really just don't know what valve disease is. So we decided we needed to do something to change that. And we launched Heart Valve Disease Awareness Day. So this is back in 2017, which was the first year we did this. We launched it on the Hill which is this picture you see here, and I'll talk about a little bit more in a minute. It's officially recognized by the U.S. Department of Health and Human Services on their National Health Observances calendar, for what that's worth. I mean, I don't think National Margarita Day is, but we share February 22nd with National Margarita Day. And my comms team knows I've tried desperately to try to find a link, and I don't have it yet, but someday maybe we'll have margarita glasses with the logo. But it is officially recognized, and this year there will be a toolkit, so hopefully people who go to the site to learn more can easily plug into the day. We also, that first year, were recognized by a congressional resolution. Representative Tony Cardenas basically made it official on the Hill and said this is a worthy day we all need to know about, and then help spread the word through his constituency. And that first year we were joined by 29 organizations. So every year we, in addition to a lot of other activities, which I'll tell you about in a moment, we host a flagship event. So that first year we had an event on the Hill. And we were joined by the head of the National Heart, Lung, and Blood Institute, Dr. Gary Gibbons. Actually, that was the last picture. I don't have him here. But the second year, we partnered with Inova Heart and Vascular Institute, so a hospital that's in our area. And we had an event there, and we had a fabulous patient who spoke about his experiences. Last year, we partnered with the MedStar Heart and Vascular Institute, another great hospital in the DC area. And we had a lot of fabulous speakers, including our own Sue Peshin. But we also had the U.S. Surgeon General Vice Admiral Jerome Adams there, and Dr. John White, who is the Chief Medical Officer for WebMD. And then that second year, we were also really excited. We got to ring the New York Stock Exchange bell and really raise awareness that way. So this is just a quick snapshot. This is from last year, so it just gives you a little idea of the impact we're able to make. So we, as a campaign, try to create the resources that make it easy for all of our partners to engage and have the same message, be on the same point, and then to share all of through all of their outreach channels. But we also lead a lot of things like TV PSAs and radio media tours. We do print ads and op-eds, and this just gives you a look. We were proud, I don't have that statistic up here, but we estimate that we reached around 150 million people last year. And we did about 8.5 in a really high impact way. So where we know we were engaging, they were hearing, they were listening, they were watching videos, et cetera. I think this is the most important slide, but it's the hardest to read. But this is our partners this year. So we're up to 74 partners, including Rock from the Heart. And we really couldn't do it without them, because it's become something, as Kelsey, my colleague, and I know well, we have a hard time controlling it now because there's so many people participating, but that's a blessing. So they all come together, and sometimes it's just a tweet, other times it's enormous events, but throughout February and on the 22nd, we have people engaging. This is just a look at some of the events that go on. There's health fairs and screenings and symposiums. There's listen and learns, there's podcasts, you name it, it seems to happen on Valve Disease Day. So another important piece of this is if you want to get engaged, how can you? I'm going to focus the most on the first two, spreading the word and sharing your story. But if there's someone in the room that wants to talk about an event or becoming a partner, we'll be here all day and tomorrow, so come find us. And now I'm stealing my colleague's slides to talk to you about how to engage on social media. Most of our social media happens on Facebook, Twitter, and Instagram, and it's all through @ValveDiseaseDay, so it's easy to find. One of the things that's really easy to do to show your support is to change the frame around your Facebook profile photo. You can just go to Facebook, pick the profile pic frames. You basically tell it how long you want it to be there, and voila. And apparently, it's easier to do on your smartphone, although I haven't done it. But Kelsey, who was featured in the picture, can show you how to do it if you're interested. You can also invite your friends. So if you know people who you think really would like to be involved, there's an easy way to go to Facebook to get them to tune in. So you go to facebook.com/ValveDiseaseDay. You can scroll down to the community section, choose invite your friends, and then you can choose who. So it can be select all, or you can just choose a few. Bless you. So we try to give people tips on how to engage at various points throughout Heart Month. Since we're about 2 weeks away, I thought I'd focus in on the immediate social. This year we're about, well, every year, we're about a week away on Valentine's Day. So it's a great opportunity to share a post, to put something on Facebook, and just to let people know it's coming. We're hosting a blog carnival, and I don't know if any of you have access to a blog or if you have a partner that you could share a blog with, but if you do and you want to write and share your story, we're happy to include it on this URL here. And basically what we're doing is it will all come together and we'll share it the Tuesday before Valve Disease Day, and you'll just get to see everybody's stories shared in one spot. On Wednesday, leading up to Valve Disease Day, we'll be hosting a Twitter chat. So you can tune in and just follow along if you want, share your stories, share a picture in your sunglasses, whatever moves you. And then we'll be celebrating our partners, which is probably the most important thing, and we'll be featuring stories, we'll be featuring logos, and just basically getting everyone to understand how many groups are involved. And then the Friday before, we'll be meeting up with Dr. John White. I mentioned him earlier. He's the Chief Medical Officer for WebMD. And we'll be talking with him and a patient just to get some perspective. And we'll be sharing it all on Facebook Live at 1 o'clock. Day before, just reminder messages. Please feel free, if you see something we've posted and it's just easier to retweet or to use the imagery, please feel free to use it. And then again, just a reminder of all our various handles. And then I think there's some handy tips from Janelle. Just some past traffic here. Oh, Janelle, I would be remiss if I did not remind everyone, if you post on social media, to please tag Valve Disease Day. And then just some tips on best practices. Facebook, we found people really engage there. It's a great way to share with family and friends, and it's a good place to start a conversation. Twitter, you're shorter, you're more likely to be reaching out to people who are like-minded, who may already know about valve disease, but it might get them to join the conversation and learn about it. And Instagram, obviously, that's where you put your sunglasses selfie. And then some handy tips. I mean, anything with a photo, anything that's not too text heavy is going to do well. Just remember to use the hashtag. And then, I actually post early in the morning and late at night, so I violate this every time. But if you can post midday, you might have more luck. And then this is just a reminder that we have a lot of sample graphics. At valvediseaseday.org, we've tried to make it easy. We have photos, we have graphics, we have suggested tweets. If you want to engage, it's there. If not, you can email one of us, and we're happy to help. And we've got videos, we have selfie signs. And that's it. I mean, I would love to ask, since you all have a pair of sunglasses, if you feel so inclined to get involved, that you take a selfie and share it on Valve Disease Day. It really is something that has become a movement and is really dependent on everyone sharing their stories and letting people know that other people are going through this. So if it's someone who has already had an experience with Valve Disease Day, it's great to see other people with experiences that they're sharing. But also, this is one of those things where we know awareness really makes a difference, and we're really hoping that people will start to understand the risk factors and the symptoms and tune in. So that's it, but we're here, so if we can answer questions, we'd be happy to. And now I think I have to turn it over to switch the computers, so I apologize for that.